for Valley Regional. And certainly that area of medicine in the Valley is certainly, we are at a decided disadvantage, and especially with patients elderly patients that have to come to Halifax for this kind of treatment. And I know there is a desire to certainly have that area covered in a strong fashion at Valley Regional. And I was wondering, do you have any kind of timeline, possibility to offer Valley residents in terms of that medical service?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The provision of the services of oncologists is the challenge is to reach as many people as we can, in a manner that does not require them to travel great distances. However, the challenge is to provide the service in a way where we're able to meet the demand, even though that demand may not require full-time services of an oncologist. And we are attempting to have clinics provided, just to reference the use or Dr. McIntosh's operation in Antigonish, and that's done on a part-time basis to meet the demand that exists there. And that model is being employed throughout the province. Now, with the specific reference to Valley Regional will be a question of analyzing the demand for that particular area and seeing whether it's appropriate for part-time clinics to be there, or indeed whether I can't say at this time. I don't have enough information before me to provide a question as to what the demand is there relative to full-time employment of an individual. However, the province-wide objective is to ensure that through satellite clinics that we are providing service to as many people as close to their homes as we possibly can. And that is a process that is evolving as we develop and find resources to address it.
Thank you, Minister. The honourable member is going to pass his time. Okay, the honourable member for Preston.
Thank you very much.
You have approximately 20 minutes.
How long?
Well, it's about 19 minutes now, member.
Minutes? Okay, thank you. I have a few questions for the minister regarding home care, and it's some unusual things have happened in the last while in home care, and it seems that the care when people come home from the hospital isn't there, doesn't seem to be there anymore. I have one constituent and one other one that had brain surgery here within the last year, and been sent home from the hospital in good condition, very good service at the hospital, not a question about that at all. But when they applied and they qualified for home care, to help them get through some of the basic things they had to do so to make sure they would stay out of the hospital, it wasn't there. In the story they were told there wasn't enough home care workers. Then I know several home care workers, and I checked with them, and they weren't getting a full week's work, and some weeks they were working very little. So there seems to be some kind of a disconnect between the home care contractor, in this case I believe it was Northwood Home Care, probably, but I'm not sure on that, and the workers that work with them and with the home care people, that indeed there wasn't the service there when the individual needed. And in both cases, the individual went back in the hospital for an extended period of time because they didn't have the care they should. Now, that is poor economics in any way to look at economics, but it's even worse than that, because if someone is ill and they do come home and they have the opportunity to be at home and recover at home, the recoveries, from what I understand in the past, is the recoveries are much faster, and indeed it costs our system, our healthcare system, which is stressed to say the least, a lot less money, so you can spend money in other areas and do other things that you have to do. Could you give me some just general comments on that to start, and how that's structured and what might have gone wrong in these two cases? And these are just two that I know about, and I'm sure there's a lot more. And this is in this area where it's not out in a rural area where there's not the expertise to do it.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And the honourable member speaks about a situation that indeed is a challenge for us, and that is the shortage of home care workers in some areas of the province. And so the recruitment of home care workers is a challenge for us. And we put a bursary program in place last year, which pays the full tuition of students attending the continuing care assistant course at the community college in the province, in order to try and provide an incentive for people to enter that particular profession. And so it is something that we need to continue addressing. With respect to the specifics that the honourable member mentions, if the member would care to provide the specifics outside the chamber or by way of letter to me, I would be glad to try and track down what might have gone wrong in the circumstances that he has described. But the member is correct. There are challenges with respect to this. We're addressing those through the bursary program and through recruitment. Hopefully, we can diminish that shortage, and the problem will be addressed. I believe we're making some progress on it, but the fact that we found it necessary to put the bursaries in place suggests that there is a shortage there that needs to be addressed, and we're working toward that end.
Thank you, Minister. The Honourable Member for Preston.
Yes, I'm glad to hear about the bursaries. I think that's a very positive step and one that we have to do. But the problem is, from what I understand, these cases, and I will forward the detailed information, and I won't talk about them here, of course, but just in general terms, the problem seems to be some kind of a disconnect between the Northwood Home Care that says they didn't have enough funding to supply the people or enough staff, and the staff, on the other hand, were not getting not even 35 hours a week. They were getting a lot less than 35 hours a week, and maybe working 2 days a week instead of a full week. So there seems to be some kind of disconnect there. And I would ask, and you probably can't answer this question right now because I know it's sort of more detail than we should be going into here, but would you look into that and see what the disconnect there is? And I can give you more information as well on particular cases will help that. But there seems to be a disconnect, and how can you rectify that? Because the people are definitely there in the home care. I know that for a fact because I know several home care workers that are not getting the time every week, and at the same time, the constituent was telling me that they were told, now this is second and third hand information, so it may not be accurate, that they weren't getting sufficient funding to the Northwood Home Care Program to actually do all the work that they're supposed to do.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman, and I would be quite pleased to respond to the specifics when the honourable member provides them, and see what information we can provide relative to this. So we look forward to receiving the specifics, and we'll give you as much information as we can relative to the situation, and learn whatever we can from the investigation into it.
Thank you, Minister. The honourable member for Preston.
Well, pursuing this a bit further, and again, this is some information you probably should have today, your staff should have there. You know, if someone goes back in the hospital because of this kind of difficulty, and I'll appreciate your response when I give you all the information, you can do that. You know, if you take someone out of their home and have to go back into hospital again, the QE2, what's a daily cost in the QE2 for having a patient in the QE2 as compared to having the cost of a home care worker coming to the home and doing even the maximum amount of work they would have to do in a day in this sort of situation? What is the cost comparison?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I want to make certain that we are not aware of any funding issues relative to home care that are preventing people from getting treatment. As I said, we will, once we receive the specifics of the situation, we'll be very pleased to look into that. And obviously, the reason we have a home care program is because of the cost differential that exists between patients being treated in the hospital as opposed to patients being treated and cared for at home. And I can tell you the only figure I know for certain is the figure of QE2. The average cost of care is $1,000 a day in that particular facility. So the quicker we can get people at home and keep them at home, obviously is the most efficient use of funds for the healthcare system in this province, and that is our objective. But as I indicated, we're not aware of any funding issue that would exist relative to this, but we'll be quite pleased to investigate and get back to the honourable member.
Thank you, Minister. The honourable member for Preston.
Going on about home care a bit, how many home support workers are provided in the contract with the Capital District Health Board?
Thank you, member. The honourable Minister of Health.
Thank you, Mr. Chairman. I don't have that detail with me. I'm very pleased to provide the honourable member with that detail as soon as we're able to obtain it.
Thank you, Minister. Honourable member for Preston.
Has there been any discussions between the department and the organizations provide the in-home support programs to fill up the gaps in these programs between where they are and where they really should be? Is there any ongoing negotiations with that or any discussions with that within the department? And if there were, how recently have they been?
The honourable Minister of Health.
Thank you very much, Mr. Chairman. One of the things the honourable member will see upon an examination of the estimates is that because of the challenges of hiring home support workers, we have been under budget with respect to that figure because of the inability or the lack of supply of home care workers. So I'm not sure if that's the gap to which the honourable member refers or not, but certainly, you know, we're as I indicated previously, working very hard at recruitment and increasing the number of students who would decide to enter into home care work as a profession through the bursaries that we're offering. And so we hope, as we increase the supply of home care workers, that we can come closer and closer to spending all of the money that's in the budget for it. And certainly that amount of money reflects the need that is out there, and it's our objective to meet that need.
Thank you, Minister. The honourable member for Preston.
You didn't answer my question about how many home care workers there are in the central region, but hopefully, okay, I appreciate that. How many home care workers are you looking for now? How many are you short?
Thank you. The honourable Minister of Health.
That work is work that is contracted out, and it would be. I'll make the response to the previous question about the number of workers. I'll make that answer to the best that we can get it. Part of the information that I provide to the honourable member, because we need to communicate with those who are providing the service in terms of getting numbers which are reasonably accurate for the honourable member.
Thank you, Minister. The honourable member for Preston.
Back to the full work week that we talked about, and with the home care workers, are you aware of that situation? The people that actually are trained aren't getting their full week's work. That may help fill some of the gap. Now, I don't know if that's a problem. Again, with funding, you indicated it wasn't a problem with funding, or it's just the way that the contracted companies that do this are managing their time. And if that's the case, would the minister give an undertaking to review those contracts and make sure those people are fully utilized so people can get the services they need?
Thank you. The honourable Minister of Health.
Mr. Chairman, I can assure the honourable member that the thoughts that went through my mind as he described a situation of there being underutilized workers, when we're in a situation where there is a shortage of workers, that I had made a determination in my own mind that if indeed we find a situation where there are people who are underutilized, we're going to find a way of fixing that, because if they're underutilized, they need to be fully utilized, because the funds are there, and as I indicated in previous budgets, we've not been able to spend all of the money. So I look forward to getting the details, and I look forward to learning as much as we can about the member's suggestion that there are people who are underutilized, because it does not fit with the facts that we're facing, which is the fact that we don't have sufficient supply of workers to provide this service, and we're trying to do our best to increase the supply of those workers. So the answer to the honourable member's question is yes, and I had come to that answer long before he had asked the question.
Thank you, Minister. The honourable member for Preston.
I appreciate that answer, and I'm sure Nova Scotians will be very pleased to hear that you're going to pursue that, and it'll be good for all of them. Now, if indeed you can make some improvements there, and probably there always is some improvements when you look in detail with the commitment you're given. I'm sure you will find some improvements. If indeed after those improvements are in place and you do have enough trained people, are you willing to put more resources into home care when the time comes that you have to do that, to make sure that people get proper home care and they stay out of the hospital so they're not paying the $1,000 a day? That if they have to go back to hospital or stay in longer than they really should and free the beds up?
Thank you, member. The honourable Minister of Health.
Couldn't do it this year, but it's the right thing to do.
Thank you, Mr. Chairman, and that, as we look forward, is where we want to be moving Obviously, it's the longer we can keep people in their homes, the longer or the more treatment they receive in home as opposed to an institution, then the more cost-effective it is, and the better the lifestyle for the individuals involved. And that is very much part of the discussions that we will be having with the Government of Canada relative to, and it's already been, I believe, agreed to as part of the health reform initiative. So the answer, high level, is yes. We have more work to do relative to identifying funding with the Government of Canada with respect to addressing this, but that definitely is the direction that we plan to go, and it is that's that's a national objective that the people of this country want to achieve, and look forward to working with the Government of Canada in terms of achieving that objective.
Thank you. The honourable member for Preston, with approximately 2 minutes remaining.
Okay. The other question I have is in-home hospital care. To what extent is the province doing that now? Are they doing it at all? Is there any effort, or is that just gone by the wayside?
The Honourable Minister of Health.
I'm not entirely certain as to what the honourable member was referring. However, I can say that in the area that I have the honour to represent in this House, they, as far back as the 80s, established a hospital in the home program. And that was what started out first as a program called Martha Home Care, because it was an initiative of the Sisters of St. Martha in Antigonish. And what it did was provide hospital treatment to patients in their homes. That subsequently got taken over by the district health authority, and was provided by them. It is currently provided by Home Care Nova Scotia in that region. So they were very much ahead in their thinking relative to reform of the provision of health care, and there are a lot of lessons to be learned from them. And indeed,
Minister,
we will be doing our very best to ensure that programs like that are enhanced throughout the province.
Order. The time allotment for the Liberal caucus has expired. I'll recognize the honourable member for Sackville-Cobequid.
Thank you. Thank you, Mr. Chairman. So I want to continue on with where we left off, and the minister was answering a question about the $300,000 towards first responders. So I'm encouraged at their commitment to supplying funds to this group seems that it'll be continued in the years ahead. So that's important, because as in their title, first responders, they are a group of individuals that usually are on the scene of an emergency before anybody else. So the training and the equipment that they have is vital in doing. It's vital for them to do the best job they can, and by improving their training and equipment, I foresee a cost savings down the road, especially in health, with the end results with the situation or the emergency situation, because as you're aware, the treatment you get in the initial stage of an emergency or a health emergency is important, and if you get proper and up-to-date and important treatment, then the end results are better, and hopefully less time in a hospital if that's where they're going. So the need to train people that are on scene first is very important. And along with the first responders who are responding to many emergencies throughout the province, especially in rural Nova Scotia, paramedics are usually alongside with them. We have many bases throughout this province in remote areas that the first responders and paramedics work together when an emergency situation occurs. So one of my final questions, and I'll be sharing my time with the member from Hants East, and I know I asked this to the minister before in question period, so I thought maybe today would be a better avenue to maybe get an answer. It's important, I see, that the training for the paramedics is up to date. And in the Blue Book during the election that the government put out, we noticed that there was a bursary for advanced care paramedics and in return for a service agreement. It's important to hopefully live up to that, and that it's not just a commitment that they made prior to an election. So my question to the minister, because we are losing paramedics in this province that can get training elsewhere and get jobs elsewhere, and this is affecting the coverage in rural Nova Scotia. Is there money allotted for these bursaries, and can you tell me how much, and when are you going to implement this? Because the school year is coming for many of this advanced care paramedic programs is September.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman, and I'm pleased to be able to provide information to the honourable member with respect to the bursary program. We in 0304 we were able to fund 25. No, I'm sorry. Going back before that, perhaps I'll start from the
Before 0304.
yeah, before 0304, we had provided 25 bursaries. Okay, before 0304. In fiscal 0304, we provided 15 bursaries and additional bursaries. That's over and above the initial number. And in 0405, we have budgeted for an additional 15. That would be a total of 55 bursaries that are being provided, and they are $7,000 bursaries. And so that would be a total of 55 paramedics will have been funded to receive this training by the end of 0405.
Thank you, Minister. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. So if I understand this right, and from the figure you gave was the $7,000, that was, I believe, a bursary that EMC is giving to the employees, because this was in place before that the emergency medical care were giving bursaries to go to school. Is it my understanding that the bursaries announced in the Blue Book are those that emergency medical care were already offering, and you're just continuing that and you place that in the Blue Book?
Thank you. The Honourable Minister of Health.
The money that EMC does provide the bursary, but the money flows from the Department of Health to EMC for the specific purpose of that bursary. So it is a dollar amount that is paid by the Department of Health for these bursaries.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. And from that answer, Mr. Minister, the paramedics of the province are going to be quite discouraged with that, because it was their understanding, especially during the election, that there was going to be additional bursaries provided, and I guess that answered that. So for now, I'll pass the questions over to the member from East Hants with the remaining time.
The honourable member for Hants East.
Thank you, Mr. Chair, and I want to thank the minister and his staff. I recognize that not only did the member for Sackville-Cobequid inherited the constituency of the previous member from Sackville-Cobequid, but he also inherited his talent for brevity. So. You didn't mention Blue Curtains once there. And Mr. Minister, I kind of thought from your conversation there as you sat down that maybe you wanted to make a comment in response to that member's last comment. And I'm going to say, if you wanted to do that when you respond to my first questions, you could do that. I'm going to say something that might catch you off guard, but only because I think I've been in this House 6 years and I've never said it, and I'd like to go on the record to say it, and that is no privatization of healthcare in this province. And not that I have a clear indication that this is a direction that the government is going, but it's a worry that I have in a national sense. I certainly hear Mr. Klein talks more and more in this regard. We hear more about flexibility in the system, flexibility in the Canada Health Act, and I want to tell the minister that I worry. I worry about the privatization of healthcare in this country, and since I know Mr. Klein is of a philosophical, political view as this government, that it may not be today, it may not be tomorrow, but my gut tells me, and I worry, that someday down the road we're going to look at that, and I think it won't come in a rush. It'll come by stealth, and I want to say, I want to be on the record to say that if it takes the last remaining breath that I have to oppose privatization of healthcare, then I'm going to use that last breath to do that, and because I want my constituents and Nova Scotians and my family to at least recognize some point in the future, if necessary, that I stood in this House and said that. So, well, I have a number of concerns, Mr. Minister, on healthcare issues. I have a rural constituency, and actually a constituency that is made up of urban and rural. And the urban area, what we call the corridor, the area from Enfield to Shubenacadie, doesn't seem to have run into the same problems as around trying to attract a doctor and so on. But certainly, if we look at the Rawdons, Kennecook, Knoll, and that area, what we refer to as the Hants North area, it's definitely a different situation, and it's one that actually I want to say to the minister that I think the department has tried to help us out there. Those three communities for the Rawdon Health Clinic and the Kennecook Clinic and the Knoll Clinic, they have come under an envelope there, or an umbrella, I should say, and of one body, and I'm not sure that everything works as fluidly as they would like, but certainly my impression is that the department hasn't really worked against them. I think the department has tried to be helpful, and so I would encourage that. The one thing I would like the minister to consider, and I'd like to know if he has considered it, and that is that Although we have 3 doctors in Rawdon, Kennecook, and Knoll, the ones one works exclusively, I think, in the Rawdon area, and one works exclusively in Knoll. But there is one doctor who actually works partly in Rawdon and partly in Kennecook. And so the fit obviously would be better if we had, one in each one of those clinics. But none of them live in those communities. Those doctors certainly, I think one lives in Truro, the one for the Knoll area. One lives on Quinpool Road that does Rawdon and Kennecook, or at least it lives in the city, I'll say. And I think one lives in Brooklyn and Hants West, for the Rawdon Clinic. And that's not a terribly long distance away for that community, but it hasn't made the most perfect fit. And without knowing a lot about the histories of those doctors, of where they were raised, an idea that has come to me some time ago was that we should be offering incentives to students who are from rural communities, and because I think they would have a greater appreciation for the rural lifestyle and be more willing to live in those communities. So I'd like to get the minister's thoughts on that, and whether or not, actually you might say, well, look, the department's already doing that, but I'm not aware of it. And so if you could fill me in on what your thoughts are on that, in that area.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And I can, as the honourable member was reciting the communities, some memories I had of the first time that I've ever been through those communities is when I had the opportunity of working with what was then Maritime Telegraph and Telephone Company Limited, and we were replacing lines up through Tennecape and through Knoll, and it was one of the coldest Januaries that I can recall, and I can tell you the wind blew in a pretty bitter fashion. I was very pleased a number of years later to be able to return to that area for a summer visit and enjoy the very pleasant surroundings and area. And I can recall one of the things that stands out in my mind is as I traveled through on a Saturday afternoon, the number of outdoor gatherings there were in people's backyards with guitars and singing, and I almost felt like I wanted to stop and join them, but I didn't. But I wasn't wearing the kilt. No, I got. However, that's not what the honourable member was asking me about, but I was just to share that memory. It's a beautiful part of the province, and certainly has. Those characteristics well, in many respects, a very pleasant remoteness, but the challenges of remoteness that go with it relative to health care. The honourable member may be interested to know that one of the things that the medical schools in this country are coming to recognize is that in recent years, they have placed far too much emphasis on the training relative to acute care. And because of that, many of the graduates were people who were perhaps not motivated in a way that would lead them to think about a rural practice. But they're changing their approach with respect to training and placing more emphasis on a training that would have a broader perspective to it, so that hopefully as more graduates come out of our medical schools, and remind the honourable member that we've added 8 additional seats in the last 2 years, so that there are 8 more doctors now, or 8 more students now in the second year and 8 more in the first year of study. And so that will assist somewhat. We have, of course, as the honourable member would know, been helpful in providing a nurse practitioner to the area, and that has resulted in making the job of recruitment of physicians easier, and so that we're able to get people there. And perhaps the circumstances as described by the honourable member are not ideal, but the fact is the people are in fact being serviced by general practitioners in that area. Again, it's members of the House will tire of hearing me say this, but again, it's part and parcel of how we need to think in terms of changing the delivery model, and the impact of the nurse practitioner in those communities is something that's been of some significance relative to that, and we need to continue working in that direction.
Thank you, Minister.
Thank you.
The honourable member for Hants East.
Thank you, Mr. Minister. I didn't necessarily hear you say you agreed with my idea about the rural students, but I recognize some initiatives that the department has taken on, or the government has, but I would like you to consider actually making a dedicated target of some students from rural Nova Scotia to see if it's possible to get some uptake from them in terms of studying medicine. I'm curious about who monitors the role of a nurse practitioner, or actually doctors in a community to ensure that the fit is right, or that what we hope in terms of health delivery in those communities is being met.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The relationship that exists between the general practitioner and the nurse practitioner is a relationship that is defined by way of a practice agreement that is entered into before they actually start practicing. And that agreement is one which is signed off on by the College of Nurses in the province. Now, the nurse practitioners are employees of the DHAs. Okay, so but the arrangement of practice is an arrangement between the medical practitioner, who, by the way, is a private practitioner of health, and not public, paid by the public dollar, but is a private practitioner. So that is that. One of the things I neglected to mention in my comments earlier about attracting students to consider rural postings in this province. In my meeting with the Cumberland Health Authority, I was very pleased to learn of an initiative that's taking place there, I believe through the community health boards. And they have recognized there that they have challenges in terms of serving the rural population. And what they are doing is they are organizing themselves to fundraise in their communities with the idea of putting together bursaries that would be paid to students who might become qualified as laboratory technologists, or qualified as a nurse, or indeed qualified as a medical practitioner. And their objective is, they feel that if they can get an agreement from people who grow up in the area and become qualified as medical practitioners, that they, when coming back to the area, they would sign an agreement to practice for a certain period of time. But they feel very confident that once they get somebody who's grown up in the area, to come back and reestablish that they in fact will stay in the area. So that is an initiative which we want to follow very closely to see what success they have. And I've shared that with that particular story with others, because I think it's something that it will pay dividends for them.
Thank you, Minister. The honourable member for Hants East.
Thank you, Mr. Chair, and thank you, Minister. Well, I want to say that if you think it'll pay dividends, I wish you would take it on and do the funding, because I can see that community health boards, depending on your community, the ability to fundraise is going to be limited, and so I would see that certainly there will be community health boards who may more easily than others be able to fundraise in a fashion suitable enough to do this, and others that would not be able to, and certainly the more rural communities, which are lower population. We know all the statistics about depopulation in rural Nova Scotia. Aging communities, fixed incomes, et cetera, et cetera. So I see problems with in rural Nova Scotia of trying to promote this on the basis of the communities doing the fundraising. If it's something that the minister sees as a good idea, then I encourage the minister. I encourage the minister to take it on, do a couple of pilots and in a couple of communities, and I can suggest a couple of them in Hants East if you wanted to test a trial balloon there and see what might happen, because I see it as a problem to let it. It's almost downloading to the communities, and they have enough to consider. The community of Rawdon actually has the hope to build a health clinic, and and they're trying to fundraise, and they're having a pretty tough time of it. And I can see that if you were to add something else, to their list of things they're trying to do, it would be practically impossible. And actually, certainly in terms of small communities, I think the province has a role to help fund those clinics. And I know I think the province has shown, I think, a fair bit of flexibility. I think the doctors in that area are on an alternate funding strategy, and I don't think it's fee for service, and which I have to say I think the province made a good move in doing that. And so if you're looking at ways that really help bring health care to communities, I certainly would hope they'll think about, well, if we were actually to put some money into a clinic, that would keep people from winding up in a place that's more expensive to address their health care needs. So I'll get you to respond to both those comments, one around my the fact about the health boards doing the fundraising, and also funding for clinics.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And I use the example of Cumberland, and the idea came from the community health board, but the initiative itself is something the community took on, and what that reflects is that for the communities involved, they have made this a very real priority, and that is what they want to be able to do. Now, it's the question of when the role of community ends and the role of government takes over. The honourable member referenced that we're on an alternate funding program with respect to the physicians in that area. That's an appropriate response of government relative to trying to find ways of being innovative and to improve the delivery of health care and to find ways of recruitment and make it more attractive for people to go to an area. I think it's not the role of government to go ahead and supplant the initiatives of local communities relative to things. The issue of service delivery, of course, is something that rests with the district health authorities. And so relative to the clinic situation, that's a question I think that should be pursued with the district health authority relative to their planning and their initiatives. So again, and perhaps it's the reason that I sit with this group and you sit with that group, that my philosophy is that we should not be doing things that stifle community initiatives. And I think there's lots of room for communities to respond to their own needs. And I simply put that forward as an example of what's done in one area. We do not have the capacity to do it all, and communities can take responsibility for their own priorities when they deem it to be appropriate. With respect to the service delivery, however, it is a question that the DHA may very well want to respond to for that community.
Thank you, Minister. The honourable member for Hants East.
Well, thank you, Mr. Chair, and thank you, Minister. And I want to say that I disagree. I think communities can do a lot. I think communities do a lot. And I think there are communities that can't do a lot, and some can't do very much. And I think that's where, when the minister says, there's a point where community ends and government takes over, well, I think government takes over when communities can't do it. And when they recognize a possible solution to a problem, I would like to think that the government is visionary enough to say, gee, they've come up with something that might work. I think this is something that can be applied across the province, and I think we're the ones, when it comes to health delivery, who really should ensure that it's a common delivery as much as possible across the province and not a mishmash of whatever any particular community health board or community group can do. And that's definitely the role that I see, and I want to say to the minister, that certainly that may be partly connected to why he's over there and we're over here. But I want to tell the minister the over here is getting bigger all the time, and at some point it'll topple over to the point that it'll be over there, and we can have this conversation, backwards across the floor. At least I hope we'll get the opportunity, and I'm hoping we'll be able to say, well, it is possible to do that. I want to touch a little bit, since you raised the DHAs, as a possibility for the clinics. Well, the DHAs are not super in their ability either, and actually, to my knowledge, their funding comes from the province. So I looked at initiatives presently. There's a plan to build a new hospital in Truro. I think there's to make either addition or some changes to the hospital in Tatamagouche. There's, I think, 7,000 people roughly in the Tatamagouche area. There's 10,000 people in the Enfield, Shubenacadie, 9 Mile River area. And we were unable to get funding for our multi-service center, which is planned for Elmsdale. The municipality is building that. And I want to thank the province for putting some health services in there, which will actually help pay the mortgage for it. But when I look at what's being done by the DHA in other parts of the DHA. The Hants East area, I think, didn't get the funding that some other areas did get, and I think it's probably a benefit to the people of Hants East that the municipality of East Hants was willing to try to pick that up. And so I appreciate at least that the government was willing to take space there and offer services there and help with those payments. But you can see, I think from where I'm coming from, that there was definitely a difference in the way dollars were allocated in my area compared to other areas of that DHA. And one point I want to make regarding the DHA is I don't think that we're exactly in the right place in my constituency. The Mount Uniacke is in the capital district. The rest of Hants East is in the central district. But I think it would be a much more appropriate fit if the shore area, at least South Maitland to Walton in particular, probably, from what I understand from those people, a lot of those people would travel toward Truro for their health needs. But the biggest part of my constituency travels toward Halifax. So actually, I think it'd be a much more appropriate fit if most of that constituency was in the capital district. And I'm not sure whether this has been a numbers game to try to get the numbers up for the Truro area to make it look viable enough to make a case for the hospital, or what. But I can assure you that most of the people, certainly in the corridor area of Hants East and Nine Mile River area, which is a big part of that population, if you take that population plus Mount Uniacke, which is already in the capital district, the capital would be the proper, more appropriate area, I think, for most of my constituents, with a smaller group that would maybe more appropriately be in the central. But as far as the funding from the DHAs for clinics, well, they can't do any more than what the province is willing to give them in terms of funding for the DHA. My colleague who spoke prior brought up first responders, and I want to mention that as well. Local fire departments are a valuable part of healthcare in my constituency, and if you take and the one in particular that I want to raise is Maitland. I think the tax base there municipally is about 600 homes, and so it's a very small funding ability for that fire department. They spend a lot of time fundraising. I've had problems. Actually, they're trying to fundraise for a new truck, and 40 to 60% of the calls are not fires. They're first responder health issues. And actually, I think this is something the department should be looking at, as to whether or not these groups are actually able to carry out that role, and should be offering some help in that regard. So I'll listen for your response to that.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. I'm not sure if the honourable member was aware or not, but in fact there is an amount in this year's budget to provide assistance for first responders. It's an amount of $300,000. There are, I believe, 158 fire departments that would be assisted in this through training and equipment. And as I indicated in response to previous question, this is not a one-time injection of funding. It is something that we intend to include annually in our budget, and we of course will do an analysis of how the money winds up being used, and the demand relative to that money. But we do recognize the very important role that's played by first responders in this province, and it's our intention to do our utmost to ensure that they are adequately trained and the level of equipment that they have is appropriate for them to be able to play and continue to play an effective role in that capacity.
Thank you, Minister. The honourable member for Hants East.
Thank you, Mr. Chair. Well, I was raised on a farm, and so the expression "don't look a gift horse in the mouth" does have some meaning for me. I have to say, Mr. Minister, but you kind of know that the gift is losing value over time, and so in terms of the 300,000 sounds very good. If there's 158 departments, it's less than $2,000 per. This is my next suggestion is something that may not come under your envelope of authority, but certainly would be under some minister. But I've been curious as to why the province charges fire departments. I think they have to have radio permits and well, even if you consider registration, vehicle permits, whatever, why those fees? Actually, we force fire departments to pay those fees. I mean, it would seem if they're doing this job on a volunteer basis, number one, for most of them, that they're fundraising to pay the province these fees when they're actually saving the province money. It's the kind of to the ridiculous point, actually, of I had a case, I think it was the Shubenacadie Volunteer Fire Department, where one of the firefighters was hurt. And the ambulance took the firefighter to the hospital, and then they got the bill for taking him. And I had to shake my head and say, there's something wrong with this picture. So to my knowledge, we intervened. I know I think the province did give them a break on that. And but I have to say, sometimes the right hand doesn't know what the left hand is doing, but it certainly would seem appropriate to me that any fees charged by the province for whatever that fire departments need, it seems like an inappropriate thing for them to do, considering I can't see that those fees would amount to an awful lot. The less than $2,000 that the departments are going to get out of the 300,000, well, they could probably top that up a little bit by not charging them for whatever fees that if they still need the permits, that's fine. But I don't think that it's in the best interest of the province to be charging them for that. So, if you have a comment about that, then.
Honourable Minister of Health.
Thank you, Mr. Chairman. The actual fees and the setting of the fees themselves are not something that comes under this department. Indeed, I'm told that some of those fees are fees that we have to pay as a department. However, the balance is always there. If you exempt the fees, then there's less money available to provide the services. The fact is that first responders are getting $300,000 this fiscal year that was not available to them last year. The fact is that we recognize that this is an appropriate expenditure of money, and have made the decision to make it part of the budgetary base, so that it is something that will be analyzed on a continuous basis relative to the provision of that service. The honourable member made reference to a firefighter having to be billed for an ambulance fee. There is a procedure in place where the members of a volunteer fire department can be reimbursed for those fees. That's so it is there. It's I suppose a bit of an inconvenience when you have to apply to get reimbursed, but again, you have to have some control over expenditures, and there has to be a way of determining that indeed the person was a legitimate member of a volunteer fire department and is entitled to be reimbursed.
The honourable member from Hants East.
Thank you. Well, I think that would be pretty simple to do at the site. You know, when you pick the individual up, that could be determined. Well, I'm going to move, I guess, fairly quickly. I was asked by a constituent to find out if it's possible to determine how many people, and this will be difficult, I think, but how many people in a particular area of my constituency would be on dialysis, and is there a computerized way to get that information, or is that a pretty far?
The Honourable Minister of Health.
We'll do our best, if that's satisfactory for now.
Well, okay. That's pretty satisfactory. Can't do any better. I'll give the pertinent information after, Mr. Minister. But thanks. If you could even try to do that, that would be great. I guess I want to throw a hypothetical at you. In this province, if I was taking my child to a clinic, a medical clinic, and I didn't have a health card, do you think that child should be turned away from care because they don't have a health card?
The Honourable Minister of Health.
Thank you very much, Madam Chair. I believe I appreciate where the honourable member wants to go with this, and there is a provision in the budget that if a medical card is in fact outdated, that it should be renewed, and unfortunately, people abuse the system, and you have to take steps to ensure that there isn't an abuse of the system, and that's why it is necessary for us to take the step to have the cards renewed. In the event that a patient presents themselves to medical practitioner, there is an obligation by oath of the practitioner to provide treatment for that person in the case of emergencies. So if it were that sort of a situation, then the treatment would be provided. However, if medical cards are in fact outdated, then we have an obligation to make sure ours are updated.
Honourable member from Hants East.
Thank you. I won't pursue this anymore, Mr. Minister, but I just want to say that the hypothetical situation I'm thinking of would be more in a case of if it was destroyed, or some sudden circumstance that it was lost, or not just that it had expired. Very quickly, last year, maybe my timing is off, but under the Minister, Honourable Jane Purvis, when she was Minister of Health, I had raised the issue of moratorium on residential care facilities, licensing of residential care facilities, and the Minister at that time said, well, there is no moratorium. That we're really not keen to issue licenses in places that we seem to have lots of placement in facilities, but in areas that don't have them, where there basically is no moratorium. So I told the people, actually, Serenity Lodge in Enfield, that to contact the person that the minister had given me the name and during the budget debate, and so anyway, that went absolutely nowhere. The staff said, don't understand why the minister even said that. So anyway, I have talked to the people at Serenity Lodge, and at this point, your department has said to them to fill out an application, and they would look at it, and if there are people who are calling and looking for a placement, you know, that their application would seriously be considered. So I guess what I'm really saying to the minister is, it looks as though from your department that they would look at new applications, and I am really here to speak for this facility to encourage your department at the time when they do apply that this will get serious consideration. But if you have a general comment around the moratorium, I would be pleased to hear it.
Thank you very much, Madam Chair. What I can tell the honourable member is that we do, in fact, as applications are received, do an evaluation of them. And I might say that aside from that, there is a complete analysis being done departmentally with respect to the wider issue throughout the province. And what I will do is make sure that officials in the department are made aware of the honourable member's concerns relative to this application.
The honourable member from Hants East.
Thank you, Chair, and thank you, Minister. Well, I'm glad to know that you're actually accepting applications, because it seemed like last year that wasn't even possible. Just one other, can you tell me, one of these number questions that your staff may shake their head at. I know I think we've pretty much figured out, at least is my understanding, that we kind of know what the cost of smoking is to the healthcare system, or at least within ballpark figures. And if my memory's right, it's around 175 million, and if anybody wants to correct me, I'd appreciate that. But do we have numbers in terms of alcohol related health issues?
The Honourable Minister of Health.
I was trying to listen to two people at the same time.
I wonder if we have a number. First of all, if my number around smoking is right, but if we have a number on alcohol-related illnesses, if we have a dollar figure on the cost of the system. No.
The Honourable Minister of Health.
Thank you very much, Madam Chair. Your number is close to being correct. It's closer to about $180 million a year, and that just about matches the amount of revenue that we get from tobacco products. So it's if we could eliminate the use of tobacco, then we could wipe $180 million out of the healthcare costs, and it would be a wash. But we'd have a much healthier society. I don't have the numbers with respect to alcohol, because it's a much more difficult, impact to get an accurate assessment on. Relative to the costs associated with it, and that's a more challenging figure to find. I don't know if my colleague has. Yeah. But at any rate, I know that there are, in the past, and when I'm talking about the past, a long time ago that I've seen figures relative to what the cost is, but they're only estimates, and I haven't seen anything more recently. We are.
This comes from the GPI Atlantic study.
Okay.
Second-hand smoke, an additional 21.5.
Oh, yeah.
So actually, our costs are greater.
If I could share these numbers with the committee, it might be of interest. The costs to Nova Scotia healthcare system, an estimated $180 million a year. That's 9% of the annual cost of healthcare on tobacco. But secondhand smoke costs an additional $21.5 million a year. So it costs us more to treat the effects of tobacco use than we get revenue, which I believe is a statement I made here the other day in the House.
The honourable member from Hants East.
Thank you, Minister, and thank you, Chair. And with that, I'll wind up my comments. I want to thank the Minister. I want to thank the Minister's staff. I appreciate your efforts, and I want to hand over to my colleague from Dartmouth South. Thank you very much.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Madam Chair. I really appreciate this opportunity to raise a few issues. And because time is short, I think I'll put my question first and then give a little bit of preamble or background to it. I'm basically asking what money might be in the health budget that would provide some sustainability or strategy around the voluntary sector. And just as background to that, you and I both know how many provincial agencies, organizations, community groups, and others are involved in direct health care in this province. And it includes everything from the health charities to organizations that support volunteers who are raising money for hospital equipment and renovations, to the volunteers in nursing homes, the first responders, the volunteers who help out with family caregiving situations, and on and on and on. And so I'm looking for some support from the department for the voluntary sector. And I'm just wondering if there's anything in there to relieve some of the pressures that those organizations are under. Because quite frankly, you can't do your work without them. And so it's in everyone's best interest to support those community groups and organizations.
The Honourable Minister of Health.
Thank you, Madam Chair. The honourable member indeed describes a situation which we in this province are extremely fortunate to have, and that is the large number of volunteers in the health sector. You go to any healthcare facility in this province, and you see just a large number of people who are volunteers, from people who would greet you at the door to people who are prepared to give you directions in where to go, to people who are there spending time with patients on their own, people who are out fundraising, the people who are running the canteens in order to raise money for them. We do have a fund of looking for the numbers here, but we have a fund of approximately $2 million that is used to assist various volunteer type organizations. And I believe the honourable member is familiar with Community Links, which receives some funding from that particular program. But you know, the honourable member does describe a situation that we're very fortunate to have in this province, and the encouragement of our volunteer sector is something that we all need to be aware of. And I think the fact of just taking the time to thank people who give of their time is one of the most important things that we could all do to encourage that level of activity.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Minister. I just want to mention some of the pressures and challenges on that sector for the record. First of all, the lack of stable funding is a big problem. And I'm going to be talking about this when the health promotion budgets and the community services budgets come up as well. Staff and volunteers are spending more and more of the time that they were spending on programs and services, on fundraising. And this is such an important issue that I think the provincial government across all departments needs to be looking at a provincial strategy to help with this particular situation. Stats Canada information is suggesting that fewer volunteers are putting in more hours and donating more money. And while that is worthy itself, it does make the volunteers, the voluntary sector a bit vulnerable in that any major impact on the core of volunteers in this province could have a ripple effect across the level of programs and services that might be able to be delivered. So for example, when the health department develops policies around early discharge from hospitals, making the families the first charge on looking after people requiring care at home, and community services in the community, the second charge before home care services are provided. Such policy changes as having more surgery done on a day basis, a day surgery, rather than staying overnight. While these may save money for the health department, they do put significant pressure on the voluntary sector, families and communities. And so what I'm suggesting is that there needs to be more consultation before some of these major initiatives are undertaken, so that you understand that there is this impact, that these things don't happen in isolation, and that it's not going to have a severe impact on the expectations of the community and the government for the voluntary sector. Certainly the insurance issue is another one that's hitting a lot of the voluntary sector groups. There's a lot of concern among a number of boards of directors in that the insurance companies are now asking, in many cases, when you renew your home insurance, whether the individuals, the policyholders, actually serve on any boards of directors. They see that as a high-risk activity. And this, we think, we have to keep a close eye on, because it's going to have an impact on the people who are willing to serve on boards, who run many of these organizations. And there's also the general liability issues facing many of these organizations, that they're finding it more difficult to handle the premiums, and it's adding to their fundraising pressures. I also want to mention, while we certainly are pleased to see the focus on health promotion, this sort of artificial divide between your department and the Office of Health Promotion does add to the workload of the voluntary sector, and that sometimes they have to deal with both departments.
The honourable member from Annapolis.
Madam Chair, I want to thank the Minister and his staff for coming today and giving me the opportunity to ask a few questions. I guess perhaps I'm sure the Minister is well aware that my riding is in the western tip of the Valley District Health Authority. I have the very good fortune of having a community health center in Annapolis Royal, which I believe could be used as a model for much of the province. I'm sure you've heard plenty about the Valley Regional Hospital and the challenges that are being faced by it. But I'll be quite upfront, the sole purpose or the sole reason that I am here is because of Soldiers Memorial Hospital and the challenges that are being faced by it and the downsizing of it. I've been searching throughout our own district, as well as been asking anyone who might have an opinion on where a hospital the size of Soldiers fits into the plan of the health department. Everyone can describe to me where the community health centers fit, where the regional facilities fit, where does the medium-sized hospital fit in the plan of the health department.
The Honourable Minister of Health.
Thank you, Madam Chair. The facility to which the honourable member refers is a community hospital, and it has a capacity of providing a variety of services, but it has some beds to provide acute care, which are served by the family doctors in the area. There are emergency services provided through that particular facility. There's, as I indicated, the acute care sector. There are some. What was the other?
The diagnostic.
Yes.
Acute care, emergency department.
The diagnostic services that are provided in addition to that, but it is an example of what we describe as a community hospital, and the services that it provides are a very good service for those people who need that level of service, and it serves as an extremely good supplement to the regional hospital that is in the area.
Honourable Member from Annapolis.
Thank you. The member is describing the hospital. One of the challenges faced by Soldiers is and he mentioned the acute care beds quite accurately. We also have a transitional unit, which is completely full. More often than not, the 4 beds that are in our outpatients area are full on the weekends. People are not being able to be transferred into acute care facility. We're operating, and they like to boast, we're operating at a 98% capacity. Well, we heard earlier that 85 is more of the capacity we should be shooting for. So what do we tell the constituents surrounding Middleton, Kingston, Wilmot, Lawrencetown area when they're looking for a hospital to have an acute care bed?
The Honourable Minister of Health.
Thank you very much, Madam Chair. Perhaps I can be even more specific with respect to the services provided at Soldier Memorial. It's a level 3, and there's 24/7 services provided there relative to emergency department. There are 37 inpatient beds distributed among acute medical care and transitional care. That's those requiring the longer convalescence while they await transfer to long-term care. There is a diagnostic service. There's general radiology and ultrasound. Laboratory services are provided in that facility. Ambulatory care is a variety of outpatient services, including diabetic and nutrition counseling and visiting specialty clinics. There is a day surgery and for ophthalmology. 25-bed veterans unit is housed in that facility. There's an 18-bed addictions withdrawal management unit, and there is a mental health center located in that particular facility. So that's quite a wide variety of services that are provided there.
The The honourable member from Annapolis.
No one is questioning the variety of services provided at Soldiers. What I asked and what I would prefer to get an answer to is, what do I tell the patients that are located in that community who are looking for and requiring acute care services and are being sent home because there's no bed and Valley can't take them and they can't be transferred into here? What do we tell that patient?
The Honourable Minister of Health.
Thank you very much, Madam Chair. Earlier in answer to questions from the honourable member's colleague, I made reference to the provision of long-term care beds. I believe we identified a number of 30 additional long-term care beds. That will assist considerably, not just in reducing pressure at the Valley Regional, but also at Soldiers Memorial Hospital. And the honourable member is correct when you look at the capacity numbers. They are quite high, but as those beds come on stream, there should be some relief provided as a result of those beds, allowing people to leave those areas more quickly.
The honourable member from Annapolis.
Thank you. You hit on a point that I was going to ask you about, and that is long-term care patients in acute care beds. What's been before your department has been a community group in Middleton who has been looking to build a long-term care facility. That's been, I believe, in front of your department for at least the last 2 years. They're looking for some direction and whether or not there is any hope at the end of the day that something will take place for them in Middleton, or whether this is all for naught. I'd like to have some direction on that.
The Honourable Minister of Health.
Thank you very much, Madam Chair. We, indeed, I did have an opportunity to meet with a group to which the honourable member refers. But in the shorter term, what we will be watching very carefully is the impact that the additional long-term care beds that we've identified will have on Annapolis County, because what was happening previously is that there was a greater shortage of beds in Kings County, and as a result of that, many residents of Kings County were being cared for in Annapolis. As these beds are opened, then these patients, residents, will be moving back home, those that wish to move back home, and hopefully that will free up some of the capacity within Annapolis County. We will want to look at the impact that the additional beds are going to have relative to the longer term, and see just how that plays out.
This is additional, if you want to get into this, but when we look at...
If he asks me more, I will.
Okay.
Yeah.
The Honourable Member from Annapolis.
Thank you. As the Minister knows, the eastern tip of Kings County borders, the western tip of Kings County borders right onto Middleton. There's a high density of population in that general area. Can I get a commitment from the department that if further long-term beds are required, that the progress that has been put in place by Middleton will be first on the docket?
The Honourable Minister of Health.
Thank you very much, Madam Chair. I'm not today in a situation where I'm going to say who's first, second, or third. What I am in a position to say is that the facility, the proposed facility for Middleton, to which the honourable member refers, will be part of a broader analysis that's being done throughout the province relative to planning. So it will be taken into consideration in terms of the planning that we do relative to the future. We have received that proposal. I have had an opportunity to meet with the people in the area, and as we address the long-term planning, that proposed facility is certainly one that will receive very careful consideration.
The honourable member from Annapolis.
Thank you, Mr. Minister. You had mentioned earlier about the surgical suite at Soldiers. I'm sure you're well aware that suite was just over 2 years ago prior to the surgeon leaving and going to Kenfield. There are presently 3 days of ophthalmology surgery that's going on there now, and there are 2 days where the surgery unit is left vacant. Considering the problem that they're having in Valley with getting surgical room time, would it not make sense that the surgeon and supporting staff do some of that day surgery in the 2 vacant days that are in Soldiers?
The Honourable Minister of Health.
Thank you, Madam Chair. It would appear, Madam Chair, that the suggestion of the honourable member is one of those situations that's far easier to articulate than it is to put in practice, and that I believe that the honourable member can translate what I'm saying with respect to that, and that is the idea is a sound one. The capacity to be able to put it into effect is more challenging.
Member from Annapolis.
I appreciate that. I guess what I would like to hear from the minister is that is one of the challenges that his department is willing to take on. I recognize the challenges faced around that scenario. Unfortunately, that's what being in government is about. There are tough challenges and tough decisions that have to be made, and so I'm wondering if your department is looking at that or actually discussing that with the DHA and seeing if that is an option.
The Honourable Minister of Health.
Thank you, Madam Chair. And you know, the honourable member has correctly identified the people who ultimately need to address this, and those are the folks at the DHA. We have discussions with them? We've had many, and we will continue to have them. There is, however, a need to persuade others as to the value of that suggestion, and persuading others is the real challenge, and we will not give up on that. However, it is something that everyone needs to continue to work toward.
The Honourable Member from Annapolis.
Thank you. My colleague from Kings West brought up the issue of recruitment, doctor recruitment for all of rural Nova Scotia, but in particularly I wanted to speak to you about the riding of Annapolis. We're going to be faced in the next 5 years with the critical problem of many of our doctors are going to be getting to the point where they're ready to retire or certainly downsize their practices. A few years ago, we had one doctor leave Bridgetown, leaving 4,000 patients without a doctor. Two doctors had to come in to deal with that. There's a number of issues surrounding this problem in terms of younger doctors not wanting to work the same hours that their forefathers have done because they have different lifestyles. I'm just wondering if you could give some direction on where your department's going in recruiting doctors, in particularly to rural areas.
The Honourable Minister of Health.
Thank you very much, Madam Chair. We do have a rural incentive program with respect to doctors in rural parts of the province, and that is something that we continue to work on. Another challenge relative to attracting doctors to rural settings relates to the training that is provided in the medical schools, and it is the medical schools themselves have done some analysis of the work that they're doing relative to training students, and they have found that perhaps there's a much greater emphasis on acute care training in the medical schools as opposed to a broader training that would allow students to give more consideration to rural settings relative to their practices than is currently the case. Now they tend to be focused on or as a result of the training that has taken place up till now, they tended to be focused on acute care settings and wanted to set up practice in areas where acute care medicine is or would be the focus of their practice. So, as a result of the change in attitude taken by the medical schools and the change in the emphasis of the practice, it's hoped that more and more students would be inclined to give consideration to establishing in rural parts of the province. Alternatively, as the honourable member points out, or in addition to a measure such as that, as the honourable member points out, there are other challenges that have to be met, and that is to find delivery models that incorporate not just the medical the doctor, but nurse practitioners and others who can provide services in a clinical setting that would be able to serve residents in rural Nova Scotia. That's really part and parcel of primary health care reform that is being worked on, and it's something that we need to do more of. Now, in addition to the items that I've mentioned here, I would again draw the honourable member's attention to the $1 million that we provided to the DHA to do an analysis of the services that they provide. And of course, part of that is to look at it's not just services in the regional hospital, but it is services that are provided throughout the entire region. And we look forward to hearing from them relative to their plan and addressing that with them, so that part of the concerns that would be addressed, of course, is the capacity to attract rural doctors.
From Annapolis.
Thank you. I'll ask a couple of questions at once, then maybe to get. You brought up the idea of the clinics and providing services in a clinic setting. I'm wondering, from a rural perspective, if that's part of what you might see as a future plan for rural Nova Scotia. Annapolis Royal is presently in the process of putting together a clinic. If you have not been to the Annapolis Community Health Centre, Mr. Minister, I would encourage you to, I'd be more than happy to take you, but if you would want to go on your own, I would encourage you to go there. They're a forward-thinking organization. The other issue around that has been the nurse practitioner. There was a nurse practitioner in Annapolis Royal, and she left in December. And she left because her services are being underutilized. And one of the flaws that she saw in the system was that she had to be associated with a particular physician, where in the province of New Brunswick, she can be associated with a clinic. And whichever physician is working that day, she falls under. And she can collaborate with that physician who's on duty that day. So I'm wondering, in two questions there. One is if the clinic setting is something that we can look forward to seeing and expand in rural Nova Scotia. And the other issue is whether or not we are looking at the requirements around nurse practitioners to see if we can bring them more online to what is working in other parts of Nova Scotia, Canada, to make sure that the nurse practitioners we have stay.
The Honourable Minister of Health.
Thank you, Madam Chair. The honourable member, the situation he describes is, clinics will be part of the future, and an important element clinics is the role of nurse practitioners and other people qualified to provide part of the medical service. In the event that the models that we are using relative to agreements between nurse practitioners and physicians is not appropriate, then it's something we obviously would want everyone to consider relative to reviewing those arrangements. I view it as a work in progress with respect to that. And we have, for instance, we have a nurse practitioner currently practicing in a collaborative arrangement with paramedics and a family physician as part of the Long and Briar Island research project. So we will learn a great deal from that particular project, which will assist us in further formulating our approaches. So, you know, the honourable member puts his finger on something that does need to be addressed. Certainly, if somebody with those skills is underutilized, that points to a need to focus attention on that and see what improvements can be made.
The honourable member from Annapolis.
Thank you. I will extend the offer again that I'll take you to the health center in Annapolis. So it's a facility that you should visit, and it certainly does give a different perspective on the way healthcare is being provided. The other question, as you may remember, in the fall, I had raised the issue of self-managed care. I'm just wondering where that is on the radar of.
The Honourable Minister of Health.
Thank you, Madam Chair. The short answer to the honourable member's question is that the situation that I described to him in the fall, there isn't any change relative to that.
The honourable member from Annapolis.
Thank you very much, Madam Chair. The person that I spoke to you about in the fall, Rick Laird, once when the House was adjourned, spent in excess of 2 months in the hospital. All because of a situation where he was not getting the care that was being able to provide. Here's a person with disabilities who is capable of making his own decisions around his care being provided. This program is being set in place. It probably will not save the Department of Health up front any money, but in the long term, it'll save the Department of Health money because people like Rick will not be spending their time in acute care beds. The interesting aspect around this is that if Rick was able to provide his own care, he as a person would be much healthier, and in the long term, we as a society would be better off. But what's really interesting is it won't cost your department any more money because you're already paying the money. So I'm wondering what is taking so long, and as if we can see any movement on this in the next year.
The Honourable Minister of Health.
Madam Chair, I've said this before in the considerations of the committee. One of the very negative aspects of the job that I have is the fact that I'm always faced with situations where I know that if I had some additional resources, then we could do things that in the long term would improve the lives of people. And if we had additional resources that we could make investments that would result in efficiencies being achieved within the department. However, the reality is that we have limited resources. to bring to the demands that are placed before us, and we need to make our decisions relative to that. And that fact does not preclude the reality of the situation that all honourable members could get in their places and make good and valid arguments as to why we should be spending additional monies in other programs and elsewhere. When they all sat down, I could probably get up and give an equally long list of things that they had not addressed with respect to it. It's not my intention to play the federal needle record again, or put the needle on the federal record again. However, just to say it this way, if we were moving in a realistic manner toward the objectives of Romano, which is 25% federal funding, there are many of the things that the honourable member refers to that we could do, such as provide physio services, home care, self-directed care. We're not there, and unfortunately we have to rationalize the resources that we have relative to priorities.
The honourable member from Annapolis.
So considering the fact that there's a pilot project on the go right now that we know is actually working, improving it, considering we know that the federal minister is on record as saying the province will receive federal money this summer, does that mean we'll get a commitment from you that that self-directed care will be put in place this summer?
The Honourable Minister of Health.
Thank you, Madam Chair. Madam Chair, the only decisions that I can take are based on the budget numbers that I have before the committee. Those budget numbers reflect the realities of the revenues that this province has. And we have not, when we reach a stage where additional dollars flow to the province or are committed in such a way that we know they will flow to the province and it will meet the test of the Auditor General, then obviously we would need then to begin addressing different priorities relative to our expenditures. And at the time that happens, we will begin that particular process. But I can say that the program to which the honourable member refers is certainly one of the programs that would receive consideration.
The honourable member from Annapolis.
Thank you, Madam Chair. This is an opportunity for me to ask a few questions on behalf of some constituents. And one of my constituents is needing access to the sleep disorder clinic for her medication adjustment, And I'm just wondering if you would know what the actual wait time for her is to have access to that clinic.
The Honourable Minister of Health.
Thank you very much, Madam Chair. We have one sleep lab in the province, and we do know that there is a wait list for that. I don't have the numbers with me, but perhaps the honourable member could drop a line, and we'll do our best to find that number.
Honourable
22 to 24 months. For her to wait to get access in to have that adjustment done. So I'm wondering, anywhere in the budget, is there any funding in the budget that's going to address this situation?
The Honourable Minister of Health.
Thank you very much, Madam Chair. We are addressing wait times. That is, however, not one of the items that will be addressed in this year's budget.
The honourable member from Annapolis.
Thank you, Madam Chair. Another patient, as I'm sure all MLAs are constantly being brought to their attention, is medical issues that each of their constituents may have. But one of the things that I found interesting in looking at your budget number was that the dental surgical program was underspent this year by some $200,000. Yet I have a constituent who is being denied having surgery for $7,200 because it's deemed not to be a medical thing. It's being believed to be a cosmetic issue. When she has doctor's letters being written, it's the sole cause of headaches and so on. I'm just wondering what direction the minister could give me that I could give to my constituent, where we're going to go on that.
The Honourable Minister of Health.
Thank you very much, Madam Chair. This is a question of being able to meet a criteria that's established relative to the provision of such a service, and that criteria needs to be met. I understand there is an appeal process relative to this, and I don't know if that appeal has been pursued or not, but if it hasn't, then the patient might want to look at the criteria and determine as to whether or not an appropriate ruling has been made, and if there is some doubt, perhaps the appeal would be of value.
The Honourable Member from Annapolis.
I appreciate that. I was wondering if there's somebody within the department that I could forward some information to, and who specifically would I go talk to deal with this situation?
The Honourable Minister of Health.
Yes, Madam Chair, if the honourable member would forward the material to me, I would have an appropriate person within the department address that situation.
The Honourable Member from Annapolis.
Well, I will do that. I've noticed here on page 12(3) of your supplementary detail of your estimates. So for Chief Financial Officer's Administration, there's an increase of approximately $840,000. Yet, when I look through the DHAs and I look at the total increases for addiction services, it's about When I look at the DHAs and I look at the total increase for addiction services, it's under 500,000. I'm trying to equate those two numbers and why there would be such a difference.
The Honourable Minister of Health.
Do we have the page in question?
Yeah, he's looking actually at the Chief Financial Officer, 12.3, and you can see that it's going up. Estimate about $750,000.
Okay. I believe the honourable member is referencing the increase of about $755,000 for the Chief Financial Officer's line item. Is that correct? In other words, it's an increase in the estimate from 0304 of 11.4 to 12.1. And 564,000 of that is related to the service level agreement of Atlantic Blue Cross contract, and that is the wage increases and everything in that contract that they're assigned to the line item of the Chief Financial Officer.
Yeah.
Under the upper heading of administration, those articles that fall under? Yeah, great. The other, one of the other things that has been much talked about in the news has been the information system for Nova Scotia. I'm wondering how far behind schedule we are on delivering that service to ensure that we have an up-to-date information system.
The Honourable Minister of Health.
Madam Chair, we are currently on schedule, and now we did announce a revised schedule with respect to the implementation of that program, but we remain on schedule with respect to its implementation, and we believe that I can't find the completion date here. Yeah.
These are when the dates.
Yeah, I can just, if the member is interested in the detail, District 7 is fully implemented, or will be fully implemented at November '04. District 8, October '04. District 1, December '04. 4 will be April of '05. 6 will be April of '05. District 5 will be June of '05. District 3, October '05. And District 2 will be in March of '06. Those are the expected completion dates.
The honourable member from Annapolis.
How much has been spent on that system to date?
I think we have no, okay, I thought I had the answer. What I have is a breakdown of where the money is going that I can share with the honourable member.
Yeah, it's right here.
Okay, I do have the numbers here. The year 0001, there was a budget of 2.2 and an actual expenditure of 2.2. In the year 0102, a budget of 6.8, an actual of 5.4. 0203, a budget of 13.2, an actual of 12.4, and 0304, a budget of 22.1, an actual of 21.6 is the amount of money that's been spent to date.
The honourable member from Annapolis.
Who is providing that? Who is putting together that information system for the province? Where have we bought our technology from?
The honourable Minister of Health.
The software that we're using for that service is the Meditech software, which is employed extensively throughout North America.
The honourable member from Annapolis.
Thank you. One of the things that I guess maybe you could answer is, in my riding, there's a company called Brytech.
Order.
You say moment of interruption.
Moment of interruption.